Similarities and differences. The main common feature of nurse practice acts in selected states is that they contain the general provisions for nursing professions. Also, both acts aim to ensure that all nursing practitioners adhere to the requirements of safe practice. Another similarity is the definition and scope of practice of nurses. There are no significant differences between the states' acts. However, some structural divergences are present. Also, the acts use different titles for assistive personnel. In the Florida Act, such employees are referred to as medical assistants. In the New York Act, they are called support staff. Standards and scope. In the Florida State Act, the scope of nursing practice for RNs is defined as the practice of professional nursing that includes the observation, evaluation, planning, intervention, nursing diagnosis, health education, and wellness promotion, the administration of treatments and medications prescribed by licensed specialists, the supervision and instructing of other nurses. In the New York State Act, RN scope of practice involves the diagnosis, corrective measures, and therapeutic help, collaboration with licensed physicians, drug prescription, reviewing patient records promptly. LPN scope of practice is defined in the acts of both states under comparison as any person who has completed a program in practical nursing and has received a license. The duties and responsibilities of unlicensed assistive personnel are similar in both acts, and they include carrying out clinical duties, taking vital signs, preparing patients for procedures, making injections, giving first aid, preparing medical equipment, carrying out basic lab procedures. Delegation rules. In the New York Act, regulations for effective delegation are described as unlicensed assistive personnel. It is mentioned that under the supervision of an RN or an LPN or after training, support staff can be delegated such responsibilities as tube feeding of patients, drug administration, and diabetic care. In the Florida Act, similar duties can be delegated. Unlicensed assistants may perform aseptic procedures, administer medications, and perform dialysis procedures under supervision. Rules for safe practice. The explanation of safe practice regulations is similar in both states' acts. However, both documents do not refer to these rules directly. Rather, they focus on the responsibilities of nurses and mention what punishment they will receive for violating them. Thus, it is possible to sum up the rules for safe practice as follows: the administration of medications should be supervised by the RN or LPN, all procedures performed in healthcare facilities or at patients' homes should be performed at the highest level, striving to minimize the risk for patients. Nursing practitioners' incompetence in some aspects, if not admitted, should be punished. If recognized, it should be resolved through guidance and education. You can find this and many other essay samples on our website, studycorgi.com.